Hi, this is Dr. Milkey. I have a patient here who presents to the office with some pain in his heel. So I'm going to take you through a normal consultation that I do for somebody who has pain in their heel. So I'm going to talk to the patient and then I'll look back at the video at times. So how long has your pain been there for?
About 5 months.
Any injury, or have you ever had this in the past?
No, no
Okay.
injuries.
And what is there anything that you've done for it to this point?
I've looked on Google for a couple things. I've put some ice on it. I've done some stretching. I've tried to use ibuprofen, but I still haven't gotten relief.
Okay. So nothing's really helped it?
Nothing's really helped
Have
it.
you seen another doctor for this?
I have not. First
Okay.
time.
Yeah, so that's quite common. Most people come in, they've had pain for 5 months. You know, they've tried a number of things. Obviously, you can find things on Google about, anything having related to the foot. But heel pain often is plantar fasciitis. I don't assume that. That's why I do a lot of question asking and assessments of different things. We've already taken some x-rays before this, so I know what his x-rays look like. Do you have pain when you get out of bed in the morning?
Yeah, right away.
Okay, what about if you sit for a while later in the day and then you get up again? Do you have pain again?
Not immediately, but pretty much after about 5 or 10 minutes standing.
Okay, yep. And then you're on your feet for part of the day?
I'd say about part of the day, yeah.
Okay. Do you go barefoot much, or do you mostly in shoes?
Sometimes barefoot, but most of the time I'm wearing sneakers.
Okay, yeah. And have you had to stop doing some exercising, things like that?
Yeah, I like to run and I can't do that anymore.
Can't run anymore. The pain's too intense. So on a scale of 1 to 10, like how high would your pain be when it's really bad?
Right in the morning, it's up towards an 8.
Wow, okay.
And then sometimes later in the day, about a 6, 7.
Okay, yeah. And just kind of curious, like, it's been 5 months. Did you just kind of think it was going to go away on its own?
I did.
Yeah, okay. That's common. Most people do kind of think it's going to go away on their own and on its own. And sometimes it can feel better for a day or two, and then all of a sudden the pain comes roaring back again. So what I do, pain is in the heel. Is the pain on the bottom of the heel only?
Yes.
Okay. You don't have pain in the back of the heel. It doesn't go into your arch or anywhere else. Okay. Sometimes when you get plantar fasciitis, again, that's the assumption here just based on what we've talked about already. The pain can radiate to other areas if it's been there long enough. So I'm going to focus mostly on the heel, but I'll check other things as well. So any consultation, I'm checking a number of different things. So one of the things we often see here is really tight calf muscles. So I can only get his foot to about a 90-degree angle to his leg. Tight calf muscles often can put a lot of strain on the plantar fascia. It changes the way a person walks. So that is definitely a trigger for this. So stretching the calf muscle is really important, but it's not going to stop the pain. He's probably got a lot of inflammation here. Hopefully it's not beyond that. But calf stretches are really important here. So, I always check circulation. This is a young, healthy person, not expecting that to be a problem. And then I'm going to really zero in on the heel itself. So push down against my hand and then pull up towards you really hard, and then push out against my hand, push in against my hand. Good muscle strength. Everything's great there. So now I'm going to focus on the heel. I'm going to press a few areas here. So first of all, the plantar fascia is on the bottom here. We're going to press a few spots there. I'm probably expecting him to wince to some of this. So pain there at all?
Mm-hmm.
Yep, so that's a painful spot. So that's called the medial band of the plantar fascia. Oftentimes the center band is painful too. So any pain there?
Yeah.
Okay. And any pain over here?
Not as much, but still some.
A little bit there too. So pain can be all the way across the plantar fascia, from medial all the way to what we call lateral. Most of the time it's the inner band and the central band. Every now and then it's the outer band. So there's also a nerve right in this area that comes from a nerve right here. And sometimes that nerve can be painful, so we check that, and most of the time it's not there. The longer the heel pain is there, the higher the chance that nerve can be involved as well. Makes it a little bit more complicated. So no pain over that nerve. I check the major nerve here to make sure that there's not anything happening there. So as I'm tapping on here, I'm guessing you're probably just feeling me tap, correct? Okay, great. And then no pain up here in the arch?
Nope.
Okay, so the plantar fascia runs from the heel all the way to the toe, so it goes to the arch here. It's real thick. Some people get arch pain as well. Fortunately not. That does complicate it more when there is pain in the arch. So it looks like he's got very typical plantar fasciitis. His x-ray showed a small heel spur, which doesn't cause the pain, but if there's a heel spur there, we know that there's a lot of tension, and we have to address that tension. So this looks like very typical plantar fasciitis. Now, I have an ultrasound here, which is going to allow me to see the plantar fascia on the ultrasound, so I'll be able to tell whether there's some thickness of the plantar fascia or whether it's normal. So we'll take a picture here and we're live. I can actually see inside the heel, and for the most part, the plantar fascia looks pretty decent. Looks just like a fuzzy TV screen to most people, but having experience with this, I know what I'm looking for. Oftentimes I'll see some thickness of the plantar fascia. This one doesn't look too bad. There's one spot in there where there's a little bit of thickness of the plantar fascia, but not too bad. So my diagnosis based on question asking and x-rays and seeing his foot type and looking at the ultrasound here is plantar fasciitis. It's been there for 5 months. So most of the time I can get this better within 1 visit. And the way I do that is a cortisone injection. You can take all the anti-inflammatories you want. It's not going to stop the pain. Cortisone goes right into the spot. It will get rid of the pain in most cases. I'm expecting him to come back in a couple weeks and say that he's somewhere between 40 and 70% better. So that's the number one thing I'll do for chronic plantar fasciitis like this. I'll have him do some stretching exercises. And then the third thing that's important is support. I like custom orthotics. That's one of the things we'll likely do based on his foot type and the chronic nature of this condition. I'll likely make him some orthotics, not on the first visit. I want him to wear good shoes all the time, not to go barefoot on hard surfaces. That's a big no-no. A lot of women do that. They're at home. They're either in socks or barefoot in the kitchen for a long period of time. That's really a problem. So sandals like Birkenstock or Bionic or Clark sandals would be better than being barefoot. Tennis shoes would even be better than that, but something on your feet. And then of course, no like running or jumping until this pain is gone. And we have to wait a while for him to be able to do that, because otherwise this will come back right away. So that's my typical consultation for plantar fasciitis. I see 5 to 10 people every day with this condition. It's that common. And you know, I really encourage people to get here before 5 months, but it's pretty common that people wait. I would suggest that you don't. The sooner you get here, the better. If he doesn't get better with the things that I'm doing here, then I'm going to be concerned that he's got some scar tissue in there. He could have a small tear. His pain level is an 8. That's pretty high. So there's other things that could be going on, but I'll use the traditional treatments first. And if he comes back and says he's 50 to 70% better, we're on the right track here. We're going to get him better. It's just a matter of time. But again, waiting longer is always risky because of the risk for a tear, for scar tissue, potentially a bone problem. You can get a nerve problem as well. So the sooner you get to this, the better.